people in the U.S. have a dental implant. In order to increase the chance of success with the implant, bone grafts are often used. And we will be talking about our idea for an improved dental bone graft. Over 3 million people in the U.S. have a dental implant, either as a result of a tooth fracture or periodontal disease. Currently, bio-os is the gold standard used as a bone graft in dental applications. The limitations of this is that it requires multiple surgeries, there's a long wait time between surgeries, and there is a chance of failure of the bone graft, which would require an additional surgery. Additionally, the timeline to full repair can be anywhere from 9 to 18 months between tooth extraction and having a new tooth, depending on the patient and the doctor, which can lead to aesthetic, comfort, and social concerns for the patient. As a result of this, there is a need for a new dental bone graft that efficiently promotes osseointegration.
So the ideal bone graft would promote osseointegration and maintain volume at the extraction site. In addition, there are a number of other engineering criteria that the ideal bone graft must meet. Firstly, it must have the mechanical resistance to maintain the space at the extraction site, and this will also promote a larger volume of regenerated bone. Additionally, it must prevent excess micromotion. If there's too much micromotion at the healing site, the bone graft will become fibrously encapsulated. A small amount of micromotion, approximately 20 to 50 microns, is beneficial to bone formation and growth. Next, the porosity must be at a level that allows diffusion of the nutrients and cellular ingrowth. The ideal porosity is at a minimum 100 microns. The surface also must be osteoinductive and promote osseointegration, and the implant must not have a negative inflammatory response.
So the basis of our design would be using a demineralized bone sponge graft. This on its own would take a long time to heal, so we plan on improving upon this by adding a coating.
So the coating that we plan on adding is a polylactide coglycolide with bioactive glass, and it's in the form of a nanocomposite, and this will be dip coated onto the graft. And this was chosen because it increases the rate of bone healing and osseointegration, and also has less wear debris than hydroxyapatite, which is commonly used in bio-os.
So why would we choose this material and this shape? Well, first of all, we believe it's an efficient way to place the implant as it's already shaped at the tooth site, and it will decrease the time between surgeries so that the patient doesn't have to go without a tooth for so long. This would be the case because osseointegration, like Emily said, will be improved with the PBG coating. Physical health and aesthetic will be improved as the tooth is implemented sooner. However, we believe that this will remain at the similar cost of about $5,000, which is the current cost of dental implants now, because although there will be less money spent on surgeries, the materials would be more expensive. However, we believe that with faster healing and the same cost, this is definitely something that could be used in the dental implant world.
So there's a number of different companies that are creating bone grafts. Bio-os would be discussed as a gold standard. Ours would be an improvement upon this because bio-os doesn't have a coating, and ours would have the PBG coating, which would apply for a faster osseointegration of bone into the material. There's also Dentium, which is a synthetic bone graft, but that is coated in hydroxyapatite, which, as stated before, gives off a lot of wear debris. There's also Medtronic, which is coated in bone morphogenic protein, but this protein is very extensive to process. And then there's also Straumann, and they have a autologous human bone graft, but this is very common to get infections and diseases. So overall, our bone graft would be an improvement because it would speed up the process of getting a tooth and speed up the osseointegration process. I never know how to end it.